Do you get a burning pain in your shoulder? If you have a burning pain in your shoulder, you may wonder what's wrong and what you need to do about it. And there are actually several different places that a burning pain in your shoulder can come from. It can come from your neck, it can come from your shoulder, or it can come from an area in between your neck and shoulder called the brachial plexus. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain the various things that can cause that burning pain in your shoulder, as well as what you can do for each of them. So the most common thing that I think of as a medical professional when I hear a burning pain in the shoulder is of nerve problems. That typically nerve pain is what's most highly associated with burning type of symptoms. Whether it's in your neck and shoulder or somewhere else, that burning, until ruled out, indicates a nerve problem. And so the first place that I would look if someone's complaining of a burning pain in the shoulder is in your neck. The nerve roots come out of the side of your neck right here, and they run down through an area between your neck and your shoulder called the brachial plexus. And you can pinch the nerves up at the nerve root level up in the neck. And that usually is caused by a narrowing of the space where the nerves come out. So you may have a loss of disc height or degenerative disc disease, or you may have spinal stenosis, or you may have a bulging or a herniated disc that's pinching on that nerve. But somewhere that nerve root is being irritated in the neck, and it's sending that burning pain along with possibly some numbness or some weakness into your shoulder or even down into your arm and into your hand. Now, if you are having a burning pain that goes not only in your shoulder, but then down into the arm or hand, I would say that's less likely caused by the shoulder itself and probably more from the neck or this brachial plexus area here. Now, with a lot of neck type of pinched nerves, if you move your neck towards that side, that narrows the openings where the nerve comes out of your neck, and it can pinch the nerve more. So if you lean your neck to the side and you start noticing that burning in your shoulder or in your arm or in your shoulder blade gets worse, that's probably a good indication that the problem is coming from your neck. And so a good solution to that would be to go the opposite direction, to open up those nerve spaces where the nerves come out in your neck, and that takes some pressure off the nerves. Now, when you do that, you should feel a relief of your symptoms. If you don't feel a relief of your symptoms, then chances are that's not the problem in the first place. Which brings me to the second cause of a burning pain in your shoulder, which is a traction injury to the brachial plexus. Now, a traction injury means it's been stretched, and nerve tissue doesn't stretch very well. Muscles are made to stretch, but nerves aren't. And so when you overstretch a nerve, the muscles around that nerve tighten up to protect it. And so you can sometimes feel like you've got a knot or a cramp in the muscle around it because that muscle is tightening up to protect that nerve. Now, when you have a traction injury to your brachial plexus, say in football, they actually put a name to it called a stinger or sometimes called a burner. And that's because it does cause a burning pain in your shoulder, possibly down your arm, or possibly into your shoulder blade as well. And if you have a traction injury to the nerve, stretching that muscle, even though it feels tight, isn't a good idea because the muscle is tightening up to prevent that nerve from being overstretched. So whereas when you have a pinched nerve in your neck, it makes sense to stretch away from that area and open up the spaces where the nerve is being pinched. If it's being pinched in your shoulder, that's actually probably a bad idea. So what do you want to do if you have a nerve that's being irritated from a traction injury in your shoulder? Well, in that case, you actually want to get arm support. So trying to support your arm on a desk or on armrests whenever possible. If you're standing, put your hands in your pocket or support it with the other arm. Avoiding things where gravity is pulling down on your arm and your shoulder blade and overstretching that nerve is a good idea if the nerve injury has been caused by the nerve being overstretched in the first place. Now, additionally, doing exercises that will help shorten this area. For example, standing facing a wall and sliding your arms up and reaching up really high. Those are good exercises to do if you have a traction injury to a nerve in your shoulder. So that's the second cause of a burning pain in your shoulder. Now, the third cause of a burning pain in your shoulder is actually coming from the shoulder itself. And like I said, my mind first goes to a nerve injury if I'm hearing someone complain of a burning pain. So this is probably the least likely cause of a burning pain in your shoulder. But if you have an acute injury to your shoulder, say you're lifting something heavy and you feel a snap or a tear, or you're throwing a baseball or throwing something else and you feel a sudden tear or rip in your shoulder, an acute injury to your shoulder causes inflammation. And that inflammation can give you a localized burning pain in your shoulder. Now, additionally, if you have knots in the back of your shoulder, those knots can tighten up and prevent the blood from getting to the area. And that causes a buildup of inflammatory chemicals, lactic acid, and other substances, which can also give you a burning pain. And if you're feeling a burning pain in your shoulder blade, I've got another video that explains how you can use a tennis ball to release some knots and help with that burning pain in the back of your shoulder blade. But if you're having an acute injury, if you've recently injured your shoulder and you heard a snap or felt a tear or something, that's something you probably don't want to self-treat, because acute injuries are time sensitive. And the quicker you get treatment for them, the quicker they're going to get better and the more you're going to prevent them from getting worse. So if you happen to be in the St. Louis area and you do need help for a burning pain in your shoulder, whether it's from more of an acute injury or something that's been going on for a longer time and may be caused by a nerve problem, we'd be happy to help you out here at More for Life. And if you're watching this video from somewhere else, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.